Cotard's syndrome, a real psychiatric phenomenon that sounds like something straight out of horror fiction. Cotard's syndrome, also called walking corpse syndrome. People with this condition truly believe they are dead, don't exist, or have lost body parts. Some patients have refused to eat because they were convinced they were already dead or that their organs had stopped working. In severe cases, individuals stop self-care completely and starve themselves because they think they have no body to sustain. It's rare but documented in medical literature as a real delusional disorder linked to severe depression and psychosis. James Tilly Matthews. Back in the late 1700s, there was a British man named James Tilly Matthews, whose case became one of the earliest and most bizarre documented psychotic disorders in history. Matthews became convinced that a mysterious group of spies was attacking him with a secret machine called the heirloom, a device he believed could control his mind from miles away. His detailed descriptions of this machine and its operators were vivid, persistent, and completely detached from reality. Doctors eventually committed him to Bethlehem Hospital, and the case became a historic example of persecutory delusions. Glass delusion. In medieval Europe and even into the 1800s, multiple patients believed their bodies were literally made of glass. They refused to sit down, move quickly, or be touched, convinced they would shatter into pieces. Some wore padded clothes or stood for hours without sitting. Doctors documented this as a real psychological delusion. Not symbolism, the patients genuinely believed their bones and organs were fragile glass. Musical tinnitus. A lady named Susan Root from Essex, England got a particular song stuck in her head for 4 years. The song was a 1952 tune performed by Patti Page called "How Much Is That Doggy in the Window?" It got so bad that her husband of 40 years started to shout just to get her attention when she sat entranced by the song playing in her head. The rare condition was the worst at night when it's quiet. Susan had to put on the TV just so she could tune out the incessant tune and go to sleep. Capgras delusion. There are real patients who suddenly become convinced that someone close to them, a spouse, parent, or child, has been replaced by an identical-looking fake. Same face, same voice, but the patient insists, "That's not my real wife." One documented patient said the fake behaved perfectly but felt wrong, like a stranger wearing a mask. This condition is called Capgras delusion, and patients often live in constant paranoia, believing they're surrounded by duplicates. The man who wanted to be eaten. Toronto Psychiatric Hospital doctors came across a man named Stephen who wanted to be eaten. But the reverse cannibalism fetish wasn't enough. Stephen strongly preferred the eating to be done by a large, dominant woman who would then defecate him out. The 45-year-old man was described as a clean, normal guy who didn't look psychotic. The researchers ascribed his bizarre wishes to the desire to be unborn. He often fantasized about being feces or semen and being expelled by a person, the report pointed out. This problem wasn't the reason Stephen came to the doctors. It turned out he was worried he was gay. The doctors did not think so. It's called vorophilia, an erotic desire to eat others, or the love of devouring in Latin.